Yes, ma'am.
Okay, I think Miss Burgess just popped on.
Hi,
Hi.
how are you?
Good. How are you doing?
Good.
I think we got everybody. So I was just going to pop in. Thank you, Miss Burgess, for letting me pop in for a minute.
Of course, I took my time getting here. Figured you'd go ahead.
Oh, I was waiting on you.
Oh goodness.
So I just wanted to take a minute to kind of clarify some things on the clinical stuff. I know you guys have been receiving emails from me, and that's not always the best form of communication to try to get things across. So I just wanted to verbalize a couple of things to you so you weren't confused. So you received an email about your clinical and orientation paperwork and information that I added to Blackboard. So I wanted to just show you that really quick. Ms. Burgess, would you mind enabling me to share my screen for a moment?
Sure. Let's see. There, did that do it?
Yes, thank you. Okay, so can everybody see my screen?
Yes.
Okay, so if you go, when you go into your Blackboard course, you'll see this new tab here called Clinical and Orientation Information. I believe some of you have already done this, but just for those who haven't, when you click on that, you have two sections that I need you to complete for me before next Thursday. And it's this one right here, and then the one right below it, the orientation packet and clinical packet. When you open those up, when you click on the first one, oh, excuse me, I am not in student view. Give me 1 second. There we go. So when you click on that tab and open that up, it's going to take you to several pages. It'll take you in a certain order. So you just read through each page and then you click on the next page with this little arrow up here in the top right. So you'll read through each one of those, and I'm just going to click through to show you. And then after, you don't have to fill anything in on those, just read them. And then on this last page, you're going to have a little bit of instruction here, and then it's going to say click to launch. You're going to click right there. Begin just like you would an assignment or a test. And then you're just going to agree here. You'll read that and agree that you read everything, that it acts as your signature, and then you'll submit it. And that's all I need you to do on both of those. Any questions about that? All right. So the other thing I wanted to clarify was the clinical rotation. We are waiting for approval from our clinical sites to allow students back because of the COVID-19. Everything's kind of been put on hold. We are hoping that they're going to let us come back in that last week of June to start coming back then. So I did want all of you to get your online trainings that are required by the clinical sites done by the 22nd. Just so that once they do allow us to come back, then we don't have anything holding us back. We can just go. You will not be in clinical for 2 full weeks. Once I get permission from the clinical site that we can come back, they will give me dates and times that they will allow students to come. You will go one at a time to your clinical site, and you will be there anywhere from probably 1 to 3 days throughout that 2-week period, because you only have to get 25 ECGs. Once you complete 25 ECGs, you're done. If you do that in a day, you're done. If you do it 3 days, you're done. So I thought there was a little bit of confusion about that, so I wanted to clarify. Did anybody have any questions about that? Okay.
No.
All right, so now the uniforms, I think there's any questions about that as well. If you look in that clinical orientation packet, it will explain to you where you can get your uniforms, but I'll just tell you real quick. You're going to be getting wine-colored uniform from Reed's Uniforms in Anderson. And if you go to Reed's Uniforms and tell them that you are taking the electrocardiogram class, at Tri-County Tech, they will know exactly what scrubs to get for you. So just tell them what class you are taking, what class you need the scrubs for, and they will make sure you get the right ones.
If we already have the one color scrubs from previous clinicals, do we have to get new ones?
No, ma'am, that's a good question. That was Kiki, I believe.
Yes.
Okay, yeah, that's a really good question. We wear the same scrubs for every single program that we do in corporate and community education. So if you have previously bought them for a nurse aide or phlebotomy or one of the other main courses, then you will not need to get other scrubs. You can use the
Okay.
same ones.
All right.
So did anybody have any more questions for me while I'm on here? Does that clear up some of the confusion?
Yes, ma'am.
Okay. Well, I'm going to turn it back over to Ms. Burgess then. You guys have a great class, and I see you're all very actively participating, so great job. If you have any other questions, just feel free to get in touch with me.
Thank you. Thank you, Jessica.
Thank you.
Yeah, thank you.
You guys have a great night.
Thanks.
You too.
All right then. How is
Why are
everyone?
you looking like that, Carmen?
Well, I just came in out of the lake. Like I literally threw my hat on and like I went out for a swim and then didn't realize what time it was. I was like, oh my God. Like, yeah. So luckily we live close, like across the street from the lake. So I can walk right over there and the water's cold still, but it felt good. But yeah, then I was like, oh my God, it's almost 7:30. I had to rush. So, yeah. How's everybody?
Good.
Good. How are you?
Good. Everyone passed the test. I think the average grade was like 90. So there was one question that was actually incorrect on this, like incorrect answer on like this side. So anybody who got it wrong, it actually gave you the right. I went back in and gave you credit for it. But I think the class average was like 90. So that was good. Did y'all think it was hard?
Yes.
Yes?
Yeah.
How was it
Yes.
hard when the class average was 90? You guys
It
don't
was
get
still hard.
but it made you think, and you'll thank me for that later on. But yes, it was hard. But if you made a passing grade or 90 or above, like it clearly wasn't that hard, or you knew the stuff. So what do y'all think? It was bad? Like really?
Not bad, just hard.
What made it hard?
Matching the medical terms, I thought was very difficult
The matching,
because
like
they were tricky.
they were tricky. But if you remember what I said, like if you knew one thing, did y'all see my screen?
Yes.
Yes.
What, the test?
Yes.
So the 4 chambers of the heart. If y'all didn't get that right, that's a problem. So go back and look. There's only 4 chambers. You know, I gave you right and left. So if you don't know what they're called, you're going to have a problem moving forward. So go back and review that, okay? Everybody got that one?
Mm-hmm.
Right and left. I think everybody but like 2 people got it right. So those 2 people, make sure you check it and know those. Let's see, I'm trying to just go through them quick so that we can review, because I feel like each one builds on the other. So if you got it wrong, you need to know it, right? Answer to this one. What is the part that carries blood and waste products and carbon dioxide back to the heart, regardless of anything else? If I said back to the heart, what would you think?
Veins.
Right. Make sure y'all know the difference. Let's see. The muscle that flattens and contracts during breathing.
Diaphragm.
Right. Let's see. Arteries that carry rich blood away. Arteries carry what kind of blood?
Oxygen.
Away from the
Heart.
Heart.
right. Let's see. Capillaries are small blood vessels where the exchange of what takes place?
Carbon dioxide.
Oxygen.
Oxygen and
Carbon dioxide.
right. what's the part of the blood, the liquid part? If I said liquid, you automatically know what it is. But it carries
Plasma.
right, responsible for blood clotting. Again, it's a deduction kind of thing. The body systems work together, maintain a state of balance. What is that?
Homeostasis.
Right.
Homeostasis.
Yeah, I don't think anybody got that wrong. What are the formed elements in the blood that carry oxygen and carbon dioxide? We talked about this. So what are they?
D. Erythrocyte.
Erythrocytes, right. Anything with that root word, E-R-Y-T-H, is red. So you would know, and cyte, S-C-Y-T-E, actually means cell. So red cells, we know they're red. Why? They're carrying oxygen. So what is carried in the erythrocyte? So you already know what red blood cells, oxygen, actually carries that oxygen.
Hemoglobin.
Hemoglobin. Just know
I got
that.
the one before that one wrong.
You did.
I did.
Why? The only
Because
choice
I-
was like white
I
blood.
thought it was hemoglobin, actually.
Was that an answer?
No, it wasn't.
Right. So red,
So I put-
we just think red blood cell. What'd you
Yeah.
say?
I put platelets.
Right. And where are platelets? They're in the what? In the plasma, right?
That's right.
They're responsible for clotting. This is where I told you just needed to know the parts. A couple of y'all got these backwards. The first thing you come to is the pharynx behind the nose, right?
Mm-hmm.
That's the part of the body the oxygen and the breathing, the breath takes place first. What's known as the voice box? I don't think anybody got that wrong. Larynx. The trachea is also known as the windpipe. I don't think anybody got that wrong. What are the tiny little sacs? I don't think anybody got that wrong. Nervous system. Made up of the central nervous system includes the what?
Brain and spinal cord.
Right. Y'all got that. I think most everybody got that right. Which part of the nervous system kicks in, increases the heart rate?
D.
That
Sympathetic.
Right.
Yeah.
What about the autonomic system? It controls what?
Involuntary.
Involuntary. That was the one that was marked wrong. Like the answer key said voluntary, so it marked everybody's wrong, but it actually went back incorrect. So it was fine. What keeps the blood flowing?
Valves. Atrium.
What does?
Valves.
The valves. They keep the blood flowing in the correct direction,
Valves.
in the correct, right. Heart tissue gets oxygenated blood by way of the
Coronary artery.
coronary.
C.
A couple people put pulmonary, but just think the heart tissue is getting their oxygen from where? Coronary means what? Heart.
Arteries.
So you want to say coronary arteries. That's where you're getting. That's where all your problems are if you're having a heart attack. The heart relaxes during diastole
Still.
and then systole. Right. Circuit is blood from the heart to the lungs. It's called the pulmonary circuit.
Pulmonary.
I don't think anybody got that wrong. What's the term for inadequate blood supply?
D.
Hypoxia. A couple people, I think, wanted to put C or B. No. What is orthopnea? When you lay down and you can't breathe. The systemic circuit includes the heart and the blood vessels. Dysphagia, facial droop, confusion are all signs and symptoms of a
Stroke.
And what is the first thing you're going to do is get help. Call 911. Right. If you got that wrong, I would make sure I commit that to memory because we'll see that again. These are those terms from chapter 4. Some of y'all struggle with these, but just think about it. Also known as cell death, lack of O2, death. What did we call that?
Ischemia.
Ischemia, exactly. Increased blood pressure because the artery supplying the heart So what are the arteries that supply the heart? What are they called?
Coronary.
The coronary arteries. So we already know that. So they become built up with plaque and is one indication of this disease. So if I look down this list, if I didn't know anything else, what do I think it is? Coronary artery disease. A couple of y'all got that wrong. But if I didn't know, I could guess because I know that coronary arteries supply the heart with blood and oxygen. But this is what this is when it becomes disease, also known as hardening of the arteries. So when they become sclerosis, y'all should have learned in medical terminology, means to harden. Athero is like another word for artery. So hardening of the arteries is going to be atherosclerosis. Chest pain, shortness of breath, pain to the left arm, dyspnea or difficulty breathing, and nausea can all be signs of
My MI.
myocardial infarction or heart attack. The enlargement of the muscular layer of the heart,
Myocarb.
cardiomyopathy.
Yeah, I said it backwards.
Productive frothy sputum is what?
Congestive heart failure.
Right. Regurgitation of the blood is a symptom of this disease.
Valve disease.
Valve disease. With a heart valve disease, there's an increased risk of what because of incorrect blood flow? Incorrect blood flow causes the blood to pool, then you're going to end up having a
Blood clot.
blood clot, and you can have one in your heart. It's terrible. A blood clot occurring in the lower leg is a DVT, deep vein thrombosis. A blood clot in the lungs is also known as
Pulmonary
pulmonary
embolism.
embolus. Chronic what can cause a stroke, heart failure, kidney disease, kidney failure?
Hypertension.
Right. So that's that. These. A couple of y'all got these wrong. You'll need to know these. The blood flow from the right atrium to the right ventricle. What is the valve that controls that?
C.
See?
Tricuspid.
Oh, yeah.
Allows blood flow from the left ventricle to the aorta. If you didn't know anything else, could you guess what this might be?
D.
The aortic, right. Allows blood flow from the left atrium to the left ventricle.
A.
Mitral or bicuspid. And allows blood flow from the right atrium to the pulmonary artery. If you didn't know anything else, you could guess.
Pulmonary.
Pulmonary. So y'all make sure you know those because that'll be important. This one, a lot of you didn't have problems. I think one of you started off wrong, but this is the flow. It goes from the inferior to superior vena cava. It goes to the right atrium. Then it travels to the right ventricle and to the lungs by way of the pulmonary artery, picks up oxygen. It's pumped to the pulmonary vein, to the left atrium, then to the left ventricle, where it's pumped to the aorta onto the arteries. For the most part, everybody got that right, but I think there was one or two I think it just weren't really thinking. This one you have to know. So if you got this wrong, y'all make sure you check it. So the heart is located where? In the
Thoracic.
right, between the lungs in the mediastinum.
Mediastinum.
The center of the heart lies to the left of the body, of the midline of the body, between the second rib and the fifth
Intercostal.
space. Right. The what of the heart is wide and it's superior.
Apex.
Nope. What's wide and
Base.
superior means what? Towards the head, so it's the top part. It's called the
Base.
base, right. And the apex of the heart is narrow and it's inferior, meaning it's away from the head. That does seem confusing sometimes, so you have to just think, okay.
It's upside down.
It is kind of. You always think, oh, that wide base part should be at the bottom, but It's just wider at the top. So if you think about a heart, it's wider at the top. It's just flipped. So anybody have questions about the test that they didn't understand or they think they got wrong, or any questions about that? No.
Mm-mm.
No? Okay. Did everybody get the outline for chapter 5?
Yes.
It's just that basic outline. It's just got terms on it. Everybody got that they can follow along and make notes on, or make notes on whatever you make notes on? Yes, no, maybe.
Yeah.
It really comes from the chapter. So if you read chapter 5 and do the review and study the PowerPoints, which I'll send y'all, I'll also put them up on Blackboard. That's where this outline comes from. But it seems like a lot of information. But once we start to use it more, you'll know, and the terms will become easier to understand. It's just good to get this part down so you know what's happening moving forward. So everybody ready to start chapter 5? Any questions? These
Yes.
move along quick, but yes, questions? Go ahead. No? Yes? So did y'all's outline start with like, what is the cardiac cycle?
It says what is.
Yeah, and then under that, does it say cardiac cycle?
Uh-huh.
Okay, I wanted to make sure y'all had the right one. Because it doesn't list that on the PowerPoint, but does anybody know what the cardiac cycle is?
No.
Do y'all see my screen? It's the PowerPoint.
Yes.
Okay. So cardiac cycle is basically what is happening here: depolarization, repolarization. So the cardiac cycle, now we have to start thinking about doing your EKG. So we learned about the flow of the blood. Now, what's a cardiac cycle? It's one heartbeat. It's one cycle of blood, like we talked about, that's generated. So when you look at an EKG, you have all those complexes. You might have like 10 across the page. One of those is a cardiac cycle. That's all it is. So one cardiac cycle is one heartbeat. It is one pump of blood flow. It's one cycle of depolarization and repolarization. So what is depolarization? I can tell
The
you
change in electric charge, negative,
right,
positive inside
from
within the
positive, right, from within the heart cell. So when you think about something that's depolarized, and now we're talking about electrical activity. So now we got to think, okay, let's flip switch now, because we were talking about the mechanics of the blood flow, right? Now we're talking about electrical activity, because what's making your heart beat? It's
the
chemical.
valves open and closing,
Well, right, but what's driving that?
blood.
And right, but what's driving that? The heart's got to move, right? I mean, but you're on the right track. But what's driving that? It's a chemical, actually, reaction. It's an electrical charge caused by this chemical reaction in each cell of the heart. When you think about it, it's just like so crazy that you're just sitting there and your heart's beating. But what's driving it to beat? It's just not beating on its own, right? Something's got to be driving it. So really, it's literally an electrical charge made up of chemical changes in each cell. That's why, like, you hear like people like the potassium's off or their mag is off, and it makes their heart rate flutter or whatever. Grandma didn't take her potassium today, so her heart rate's off, because that heart cell, each cell has to have the right chemical change in order to make that heart beat. And in one heartbeat, you have one cycle of depolarization and repolarization. So what do we need to know? When we look at that one heartbeat, that's what's happening. So depolarization takes place in each cell, and it is that electrical change in the heart where the voltage becomes more positive, and it causes the cell to contract. So if I think about the heart as a whole, and it contracts, to push that blood out, what is it doing? It's depolarizing, right? Everybody get that part. Depolarization is a change in that cell from negative to positive. It becomes charged, right? And then what happens? It sends it on. A heartbeat is 2, right? And as we get further on, you'll realize that this electrical charge starts at the top and is sent down the heart to cause a heartbeat. The top's got to squeeze to get the blood through. So you're right. The blood going through the heart causes the heartbeat and it drives everything. But what's ultimately driving that? Each heart cell and their chemical chain. So when you hear the word depolarization, you think, oh, the cells are becoming more positive and they're going to what? They're going to contract. It's going to give them more bang. It's going to give them more charge and it's going to cause them to contract and make your heart beat. So then it repolarizes. One cardiac cycle is a depolarization and repolarization, right? So if you repolarize, what's going to happen?
The change in electric charge?
Right. That electric charge is going to become negative. It's going to give its charge to the next one, and it's going to sit back and rest. So you got depolarization, repolarization. You relax, you rejuvenate. It allows that heart to just take a break for a second. So the cells are constantly charging, uncharging. How do they do that? They're actually giving their charge to the next cell, right? That is that voltage that goes through your heart. That is what that EKG is picking up, electrical activity. How is electrical activity picked up? It's that EKG is just getting it. How are we getting it? It's those chemical changes that are causing it.
Through this cycle?
Right, through this one cardiac cycle. So if I say to you, what happens during one cardiac cycle? What are you going to say?
Depolarization.
One heartbeat.
Well, but what? Who said it first? Depolarization
And then
repolarization.
Yeah.
Contraction, relaxation. That can be interchangeable, right? Because we're not talking about the mechanics of the heart right now, depolarize and repolarize. We're talking about that electrical activity caused by the chemical changes. But mechanically, what's happening? In depolarization, right. In depolarization, mechanically, what's happening to that heart? It's contracting. Repolarization, what's happening to the heart?
Relax.
It's relaxing. So one cardiac cycle includes depolarization and repolarization of the heart cells. It happens quick. It's a heartbeat. If you feel your heartbeat and you feel that bump bump, that's one cardiac cycle. That blood went through your heart. All those cells got charged and repolarized in that instant. It's crazy to think about. So everybody got those two things. Right?
Yes.
Opposites have to happen, right? Because your heart has to beat in a sequence so that the blood will flow through. So what's happening is those cells are charging and recharging in like an opposite function because you need your heart to beat in sync so that if your heart beat at the same time, what would happen?
Nothing would get charged and nothing would relax.
It would just sit there, right? The blood would just sit there. Nothing would get pushed through. When we learn later on where it starts at the top, that little node, AV node that that starts that electrical activity. It sends it down the heart. It literally sends it down a pathway. Charge, relax, all the way down. You'll be to the point where you could look at that EKG and you'll know, oops, that charge did not happen where it should have. It happened further down in the heart. This person has a problem. So that's why knowing what is happening is good to know, because then you can kind of look at it and tell, oops, it's not happening like it should. So this whole chapter talks about the different tests, what we're actually looking for, the different parts of the EKG machine. This is where we'd be in class. We'd all look at the parts, but you can go in your book and literally look at the pictures of it. I'm sure you've all seen the EKG machine. The electrodes. What do y'all think the electrodes do? When somebody puts those on you or you put them on a patient, what are those electrodes actually doing?
Conduct electricity.
That's it, right. They're not feeding the machine. They're not picking up the the electrical activity. They're the conductors. That's all. The pad that you put on is a conductor of that electrical activity. When you have a lightning strike to your house, there's got to be something that conducts it, something that has to like receive it before it can be sent. So those pads literally are the conductors. That's why they're kind of gel on the back. They're sticky. What do you think is necessary to keep, if you're an EKG tech and you're there for the whole shift and the person before you left all the electrodes out, what's going to happen to them?
And that's gonna be,
They're going to
they
be dried
can't
out.
really, yeah.
No, right. They can't use them. They're going to be dried out. You need to keep them sealed. You need to keep them protected. They got to have that sticky conduction. Like when you have an ultrasound, or you have an ultrasound on your leg, they put the gel there because it's a good conductor. That's why the back of those electrodes have that gel. So what do we need to know is that those electrodes, we have to protect them. We have to keep them sealed, keep them from drying out, because that's what's helping us to get signals from the heart and that electricity, right? The lead wires. If we were in class, we'd look at the lead wires, we'd lay them out. How many lead wires are there?
12.
Are there? There's 10. We'll get to why it's called a 12 lead EKG, but there's 10 lead wires. They all go to a specific spot on the body. Well, you'll learn those backwards and forwards. Those lead wires are placed on the electrodes in certain areas so they can pick up that electrical activity. So each lead wire is color coded. They are usually labeled, so you'll know right arm, right leg, left leg. Every EKG machine should have a manual. You should know your hospital policy. But the lead wires, what do you think is important, especially if you have a person who has MRSA or you got to, sometimes they're not disposable. So you have to know your policies, cleaning and how to disinfect those. Again, lead wires are what's giving us the lead or the view of the heart. So the electrodes, what are they doing? They're just there to conduct the electricity. Everybody know the difference in those?
Mm-hmm.
When you hear a lead wire, those are interchangeable with like a view. So if they say, oh, they're looking at the, left leg view or whatever, the lead is what's giving you that view.
We won't be getting in those, like anything to do hands-on with in the mail, or we have to wait to clinicals.
They're hoping that they can get you in the lab like before your clinical. It's just kind of a wait and see at the moment. But I mean, we're going to try. Yeah. But again, when you go to clinicals, they know that you've been learning online. So they know that there has been a change in things. And they will let you look at the machine, play with. There's two in the lab at Tech. If you called, maybe they let you, come in like you did your books, like scattered it to look at it, put your hands on it. Like you'll be able to there'll be some good graphics of like the lead wires and has everybody seen an EKG machine?
Yes.
Yes.
Okay. It's usually on a cart. It's got a little screen. It's got a little computer. You put the patient's information in. You use your electrode. You are always going to place your electrodes in the same spot, unless there's something funky going on with your patient, and then you have to put them in a different spot, which we'll get to that. But oh, these are my electrodes, however they look. Some places use the electrodes that you clip. Some use ones you like stick on, you push on, but you will know what you're doing. So it's just a matter of learning that equipment, and that's the standard. Even if I went to the hospital, I would have to learn whatever new equipment there is. So that's pretty standard. All right, let's see. We went through repolarization, electrodes, lead wires, leads. So what is a lead? It's basically that imaginary line between two electrodes. So, and they each produce like a different EKG tracing or a different view of the heart. So if somebody asked you, like, what do the leads do? That's what you're going to say. It's that electrical activity that's measured. They measure that in several different directions because that electricity travels in several directions. An EKG tracing, basically that is that
The result?
rhythm strip. Right. The result, that rhythm strip that you get, the paste paper with the EKG on it. Excuse me. But that's your tracing. That's what they call it. It's interchangeable. Just know that it means an EKG or rhythm strip. It's just a tracing of the heart. It's basically giving you a visual of what's happening electrically in the heart. That is not telling you mechanically what's happening. Does everybody get that part? We are recording electrical activity. An echocardiogram, that is not an EKG. That
Uses sound?
I'm sorry?
I said it uses sound.
Yes, it uses sound, like echo, that's sound. It uses sound waves. So if somebody does, like, it's almost like doing an ultrasound of your heart. They will do that to see if there's a clot or if the valves are not shutting properly, see if there's a mechanical problem. But just know, if you see echocardiogram, I'm not going to try to fool you with that, but you may have a test that, like, they throw that in there because they want you to pay attention. So echo is always going to be something with like an ultrasound. So remember these points. This is the cells of the heart create and conduct electrical activity. The signals prompt the heart muscle to contract and pump blood, and the movement of those electrical signals is called cardiac conduction. So that electricity is conducted through the heart. What happens? What happens when it contracts? What's that word?
Depolarization?
Right. And then when it relaxes is
Repolarization.
exactly. That electrical charge is going from positive to negative. Everybody good with those?
Yes.
Yes.
You didn't have voltage down, the term for voltage.
That what voltage is basically the electrical charge. So it measures the electrical activity between the two leads. So if I was looking at that, your voltage is basically, if you think about, like, oh my goodness, this man got struck by, or stepped on a power line and he had like 800 million volts of electricity through his body. That voltage is just basically that electrical charge. It's measured. You measure, like you have a 9-volt battery. That's just the voltage is the amount of charge that you're going to get in that battery. So that electrical charge and voltage are kind of interchangeable. Got that? Everybody good with those?
Mm-hmm.
Okay. This is on the PowerPoints that I'll send y'all. It's just basically another review. They drive this home because so the pattern is continuous and occurs in cycles. It just happens over and over and over. When it doesn't happen right, when you have a problem. So depolarization, repolarization occur in such a way that the atria and ventricles contract and relax at opposite times and allows the chambers to fill and then pump out blood. So if you have a normal heart rate, you're getting depolarization, repolarization, depolarization, repolarization. So you can start to think, if that's not occurring normally, what's going to happen? Is the blood going to flow correctly?
No.
No. So that electrical charge is very important, the way it flows. It flows from the atrium down to the ventricles and back around. That's how it has to happen. It starts in the atrium. You'll learn that, but that's what happens. If it doesn't fire correctly, that electrical charge gets mixed up. So again, this is just a review of your EKG machine because you will have to know all of the parts. But the pads, what are we doing? What are they doing? Only conducting, right? What is doing the transmitting of the electricity?
Lead wires.
The lead wires, right? So the EKG machine is measuring the electrical activity between the sets of electrodes, right? So it can examine the different views or areas of the heart. The views are the leads. We're all good with that. EKG records on activity paper and creates this EKG tracing. There's a difference between lead and electrode. I think we've driven that home. Each lead is a view of a particular area. You will get to know what that is. So, does the EKG provide you the information about the mechanics of the heart?
No.
No, it does not. What is it showing you?
The electrical.
Right. So it's not showing you mechanically. Now, can it indicate where there's a problem? Yes. So when they go to look at that in the different leads or different views, they can tell where the problem is. You will learn that as well. That's part of actually this chapter. Certain leads look at certain parts of the heart. We'll get to, here's voltage, difference in electrical charge. EKG machine, just review your PowerPoint on that. So these are your different tests. You will have to know these backwards and forwards, and not necessarily tests, but like telemetry. What is it? Anybody know what telemetry is, like off the bat without like reading that? Like if you have a telemetry floor in the hospital, what does that mean?
Record the heart rate and rhythm.
Heartbeat, yep, and rhythm. Right. So it's a continuous monitoring of the heart rate and rhythm. You can use it in the emergency room or in the hospital. You won't have telemetry at home. Generally, it's more of that. So someone in like a central monitoring station in your hospital you might choose to do that. That might be what you want to do. You're responsible. You might have like a hall of patients and you're responsible of watching the monitors, and every hour you have to run a rhythm strip so you can put it on their chart for the doctor's review. You would notice if there was anything different. That's telemetry. So it's a continuous monitoring. All right, ambulatory monitoring. If you didn't know anything else, what does ambulatory mean?
Walk.
Well, you can walk around. It can record it over time at your house. It's usually a Holter monitor. I don't know if anybody's heard of that. A Holter monitor. If you go to the doctor and you're like, oh, every once in a while my heart just like starts beating really fast and I don't know what's happening and I feel really tired. They may put a Holter monitor on you to measure what's going on for 24 or 48 hours. So you might work in a facility where you would have to put that on the patient and explain how to use it, when to take it off, when to put it on. Do you wear it in the shower? No, like those kind of things. So ambulatory monitoring generally means like a Holter monitor or a mobile telemetry monitor. It's a continuous thing and you take it in and it records what's going on. Holter monitor, usually 24 to 48 hours, and then they continue on with their normal life, blah, blah, blah. As a EKG tech, again, you might be responsible for putting these on. Let's see. An event monitor. I don't think that's on this list, but just write that over to the side. Event monitor is basically the same as a Holter monitor. It's just exactly what it says. If you are experiencing shortness of breath or heart palpitations or whatever, and you tell the doctor and they put a monitor on you, instead of it monitoring all the time like a Holter monitor, it will have a button on it and you'll just push that button. Oh, I got out of the shower, I got lightheaded, my heart started beating fast. I put my monitor on and I push the button. Or I'm going for a walk and all of a sudden I feel my heart fluttering, so I push the button. That's an event monitor. It's basically a Holter monitor that gives you a chance to record when you're having symptoms or an event. Everybody got that one?
Yes.
Okay. Mobile cardiac telemetry.
Hold on. I didn't get the one before that.
What was the one before that?
It was event monitor.
Event?
No. The Holter
Ambulatory?
monitor.
Oh, the Holter monitor? That's an ambulatory monitor. That's just a monitor that's continuous, but you wear it in your normal everyday life. You might put it on at the doctor's office and you might wear it 24 or 48 hours, and then you take it back to the doctor. And they download the information and it shows them what you're doing the whole time. Your heart. And like sometimes they'll have you keep a diary, like I was sleeping, I woke up, so that they can see, oh, this is your heart, what it's doing at that time. It's just a continuous monitor, but you can go about your normal life. And the event monitor is basically the same thing, except it has a button. So if you feel something odd, you push the button. Whereas with the Holter, you would just write down what you're doing. That's the only difference. Mobile cardiac telemetry. It's an ambulatory monitor. It's like a Holter monitor. But what it does is it's basically a Holter monitor, but you're not taking it back to the doctor's office in 24, 48 hours for them to download the information. It is transmitting that information to somebody who's sitting in an office somewhere constantly watching that monitor. So you may be an EKG tech, but your job may be that you live in Kansas and you sit in a central monitoring station, and I wear a mobile cardiac telemetry monitor, and it's automatically sending it to me. What's helpful about that? If I see this person's at heart attack risk, or they have, they're waiting on a heart transplant, I can see that that's happening. I can call 911. I can call the patient and say, hey, what's going on? I can notify the doctor. It's just more of a central. They don't do that a lot anymore because it is very expensive, but just know what it is. You know what telemetry is. So if you have mobile telemetry, then obviously someone's monitoring that 24/7. Like a telemetry force, somebody's monitoring you 24/7, right? So a 12 lead, that's going to be our most common, right? When you hear 12 lead EKG, most of us have had one that are, have had a baby or have had surgery or had, they put them little electrodes all over you and they do a 12 lead. What's a 12 lead? It's looking at 12 views, right? What are leads? Views of the heart. So it's looking at 12 of them. Why are there only 10 electrodes? It used to just really throw me off. Why are there only 10? This is a 12 lead because 2 of those electrodes can give you different views. So we're looking at 12 different views, but we only need 10 electrodes, 10 lead wires, because you're getting 2 different views from the same electrode. It's just depending on how you're looking at it. Probably doesn't make a lot of sense now, but that's what it is. We're looking at 12. When you say a 12 lead EKG, that means 12 views. I can look at your heart from 12 different views. That's what we're looking at. It's the most common. You have a resting, or you can have a stress test. A stress test, you've probably heard of that. A stress test is a 12 lead EKG that you wear while you do exercise, you do a treadmill, they might put you on the bicycle. They want to see how your heart functions while you're doing this controlled exercise. If a person can't undergo exercise, they will do like a medication stress test, a pharmacological stress test. They may call it a nuclear stress test. That's what that's doing. It's a 12 lead EKG that's monitoring. That's when you say, oh, my grandfather went in for a stress test. That's what they did. They brought him in, they hooked him up, they put him on the treadmill, and they monitored his heart, and they recorded what was happening when he did exercise. Now, do you think they're going to put somebody with CHF on a treadmill?
No.
Because they're going to have shortness of breath. So that's when they'll hook them up to an IV. They'll shoot some like nuclear medicine into them that will cause the heart to beat more fast, like you're doing exercise, but they're really not exerting their lungs like that. So that's the only difference. So a stress test, but think I'm on the treadmill, so you got 12, you're doing a 12 lead EKG. How many electrodes do we use?
10.
How many lead wires are there? 10.
12.
10.
Oh.
10. Yep, 10 wires to 10 electrodes because we're looking at 12, but 2 of those use the same. Be good with that. So this is just the different tests we talked about, Holter, telemetry. Make sure you review those. That's in the book. A rhythm strip. It's an ECG. Okay, so a rhythm strip basically is telling you, or is that where we are? Are we on?
No.
Yes. No. On the outline? Are we at we're at the bottom of the first page where it says 4th row rhythm strip?
Oh, yeah, I see it now.
Okay, so, and I'll send y'all a graph paper too. I'll send that, and we'll look at that on Tuesday. But it's okay. So y'all know what the EKG looks like. It's that piece of paper with all the little red squares on it.
Mm-hmm.
And then you have rows. There's usually 4 of them of heartbeats. That's what you're looking at, right? Those are in the first 3 rows, those are your 12 views. That's what we're looking at. That last row, that 4th row, is your rhythm strip. It's a 12-second recording of the activity in lead 2, because you have all these leads, right? And the most common, the one that gives us the most information, is lead 2. So if you're a telemetry monitor and you sit on this floor from 7P to 7A and you're recording all these people's heartbeats and their rhythms, their EKGs while they're sleeping, you're going to run a 12-second, like you're going to run a strip. You actually usually do like a 60-second strip every hour. But you're running it of that 4th row. So you're running it of lead 2. And that's what you're putting on the chart because that's giving us a bigger view of what's going on. Everybody get that part? And as we get further along, and this book doesn't do a great job of explaining like the leads and where they are, but once you get that part, it'll make more sense. Like lead 2 is positioned, to the left of your sternum, at your, 4th intercostal space. So it's basically sitting over the heart. That's where you're getting the most electrical activity. That's giving you a broader picture of what's going on. But for right now, what do we need to know? What's a rhythm strip? It's a 12-second recording of the electrical activity in lead 2 on an EKG tracing or EKG paper report. Everybody get that?
Mm-hmm.
Any questions about that? Limb leads, they're exactly what they say. They're leads you're going to place where?
On your limbs.
On your limbs, exactly. So in your ECG, your limb leads are made up of lead 1, lead 2, lead 3. Those are your limb leads. Now, why do we say, oh, well, I have 4 limbs, but it's only 3? You have your right arm, your left arm, and your left leg. That right leg is usually just a ground. And when you do anything electrical, you have to have like a ground wire, right? We're not really getting any electrical activity information from that right leg or from that right side of the heart, like that part that's monitoring. That's usually just our ground. So that's why we're saying our limb leads are 1, 2, and 3. You're going to hear about bipolar or unipolar. Bipolar means what? 2. So you have 2 poles. When you think about poles, you talk about negative, positive. That's what you're talking about, electrical charge. These 1, 2, and 3, these limb leads, they are bipolar. They go from positive to negative, negative to positive. They can go back and forth. It's showing on that EKG the flow of electricity from positive to negative, from negative to positive. So it's giving a view. That's why they're right and left. That's why, like, if you have a right limb lead and a left, that electricity has to flow, right? So it's got to go from one to the other. It is picking up the electrical activity from one to the other. It's just like anything you want to run electricity through, it has to go through whatever. Why do you think, like, when you going to put the defibrillator pads on someone that's having a heart attack and you have an AED, you have to put them so that the charge runs through the heart, on the back, on the low back, and on the front, or on the upper right chest and on the left. You remember when y'all learned that in like CPR? That's why. It's got to send that electrical activity through the heart. So your leads are the same way. You want to go through the heart. So just know that your limb leads are your bipolar. They are negative and positive. They can go back and forth, right, left, and left leg. Einthoven's triangle is basically the dude who figured out what electrical, like he first recorded this electrical activity of the heart. And so when you place those limb leads in right, left, and left, that it makes like a wonky looking triangle. That's what that is. You might ever hear that. You might not. They throw it in here. That's what it is. Everybody understand those?
Mm-hmm.
Okay. When you talk about your ECG, you're going to have augmented limb leads. Don't let these terms like throw you off. Really, all that means is that these limb leads literally give them a different picture, and they are literally unipolar. They give you that image that is singular. Like it's just looking at what's going on right there. It's not back and forth. It's not the electricity going, from right to left. It's basically just it's bipolar. It's unipolar. That's where you're going to see like ABR, ABL, ABF. Those are your leads. They're actually limb leads. Like they correspond to the limbs. That's really what that is. And you'll see those more when you go down like your unipolar, bipolar. Those unipolar leads, the ABF, ABR, those are just going to help on the EKG for them to look at different spots in the heart. So if I, like a cardiologist can look at that EKG and know that if I see a problem in lead 2 ABF and lead 4, this person is
Inferior wall.
Right, is having some kind of like inferior wall, or they're having this problem. They can tell you what's going on. Will you need to really be able to do that? No, you'll be able to recognize that this is, what's happening, but you're not going to have to diagnose that. So unipolar, just know what? It's the lead that measures voltage in an electrically positive pole in comparison to the neutral reference. So basically it's just in that one. It's not the back and forth, just one. Precordial also means chest leads. They are also unipolar. Those are the ones that sit on the chest. B1, B2, B3, B4, B5. Those are your chest leads. Those are the ones that go on your chest. They go to the left side of your chest. So where do you think the best place to put your EKG machine is going to be?
The left.
To the left of the patient, because most of your lead wires are going to go on the left side. The center of the triangle acts as an electronically neutral point of reference for the precordial. Do we need to know that? I don't think so, but just know what the triangle is. And just know that your chest leads are the main ones that go across your heart, across the center of your chest and down. And we'll learn those positions. You'll be able to just put them on with your eyes closed. But the reason they put them where they do is because they're getting different views of the heart. We want to know what's going on. And this electrical activity can tell us. It's crazy how it does. So here is your piece of graph paper. So this is a 12 lead EKG. This is, now what did we say this fourth row was?
Rhythm strip.
Rhythm strip. So if the doctor said, I would like to see a 60-second rhythm strip, well, you could go and print this out. Of course, you have to print it out more than one time, but this is what they're wanting. They're wanting to see this lead to what is happening here. And we all know from our last test what is happening. And what is one of these right here? What's it called?
A full heartbeat.
Or what? Cardiac conduction.
Full cycle.
Right. Cardiac conduction. That's what's happening right here. Depolarization, repolarization, depolarization, repolarization. That is what's happening in one cardiac cycle. So how many do we see here? Well, I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Well, I know this is a 6-second strip. How many 6 seconds are a minute? 10. So if I multiply 10 by 12, this person's heart rate is about 120, right? Again, you're not required to know that yet, but that's what you would be able to do, because that's what this rhythm strip is. You see how these are different: ABF, V3, V6. These are those different leads that are showing the doctor what's going on in this section of the heart, in this section of the heart. So but what are we concerned with? This rhythm strip down here. It looks good. Everything looks normal. It's, there's good, repolarization, depolarization, relaxation, contraction. This is all happening normally. So this is when we talk about an EKG tracing, this is what we're talking about. A rhythm strip, this is what we're talking about. So 1, 2, and 3 are the limb leads. So we know about the doctor. I don't know if that's relevant, but the limb leads are bipolar, right? Because they're measuring, you just think bipolar, so it's 2. So they're measuring the electrical activity between 2 points. One that's negative, one that's positive. That's all. Like this, here's a graphic of that triangle. So you see where you have your right and left. See how the charge, right and left, negative, positive. But they form this triangle because when you put that on a person, that's what you're getting. Your limb leads are your right, your left, and your left. Everybody understand that part? See how lead 3 looks differently? Move this. You see how it looks like in lead 1, this is what it looks like. In lead 2, it looks a little different. And then in lead 3, it looks different. Because you're only looking at that lead 3. But this is, you want to look at the whole picture. But this is what they're talking about. The triangle, they're bipolar. Why? Because look at the charge. It's going in 2 ways, right? It's not just there. It's not just a unipolar charge. Is that clear as mud? No. So, augmented leads. What do we need to know about those? They're also leads 1, 2, and 3, but they are unipolar, which means what?
They go in one direction.
Exactly. They go in one direction. So for each augmented limb lead, you've got a positive input from one electrode. That's all that this augmented lead. So when you see the little A and the VF, that means augmented. It's an augmented lead. It's just looking at one input, just unipolar. And I think there's a picture of it here. Yeah. So you see how these are all like there's just one. You see, it's just one charge. You're not flowing back and forth. You're basically just getting one charge. That's all it's measuring. Do they use these alone? No. When they look at like a section of the heart, they might use lead 2, ABL, and lead 4, like to decide which part is not working right. These are just a reference point. You won't have to know that in depth, but if I say to you, an augmented limb lead is what? Unipolar or bipolar? It's what?
Unipolar.
Right. I mean, if you knew that, you'd be in business. So here, we just need to know the difference in the groups, right? You got unipolar, bipolar, that what they call Wilson central terminal is basically the middle section of where you're putting your V leads. Well, you need to know that. Not that I'm aware of, but no, it's just basically the 3 limb leads, and what the center of that is basically that Wilson's terminal. Probably another one of those doctors. Here, these are your precordial leads that we were talking about, your chest leads. Everybody see those?
Mm-hmm.
These are your chest leads. So this is what we were talking about when you're placing them in a 12 lead. You've got your right and left limbs, and then your left leg, right? But you've got your V1 through V6. These are your chest leads, and this is how they're basically placed around, they go on your chest and they kind of go around to the left to your mid-axillary line. This is what, and why you're seeing this is like, they just want you to know, like, this is what it's looking at. So when you're looking at this EKG strip or this tracing, this is totally what this is picking up, which is pretty cool that they can tell what's going on in your heart by this tracing that you've done. That's why it needs to be, look good and look clean and not have a bunch of artifact in it. But these are your chest leads, V1 through V6. So we had 4 limb leads, 6 chest leads, that's 10. And here is what we were talking about. So if you look at this, so lead 2 and lead 3 and AVF are looking at what?
The inferior wall.
Inferior wall of this heart. Lead 1, AVL, V5 and V6 are looking at the lateral wall of this left ventricle. And then here, V1, V2, V3, V4 are all looking at this anterior septal wall. It's that divider between the two. They can tell if you're having a heart attack and where it is, or if your muscle wall is doing poorly or it's thinned out. They will be able to pick up the changes in these 3. And the way they diagnose that is all 3 have to have the problem. So if all 3 of those have looking all crazy, then we know we're having a problem. What do you need to know this for? Again, when you put on those leads, that's what you're looking at. That's what they want to know. How do you memorize this? How do you know it? Again, if you need to know like which leads show us the inferior wall, you have to just figure it out to memorize it. I learned it as, okay, 2, 3, and F. F, I think of like inferior. It has an F in it. Okay. So if I'm given that choice, then that's going to be my best guess. Lateral is going to be your same way. AVL. So 1, AVL, and 5 and 6 are giving me lateral. And then your anterior septal doesn't have any. 1, 2, 3, and 4. They basically all kind of go in a line on the front of your chest. That antero means anterior or the front. So oh, that's the front of my heart. That's that front middle part. It's kind of just, I know it's a lot, but it will all kind of come together when you're placing the leads, and you're kind of seeing that there is an order to things. Let's see. Well, we already talked about that. So, continuous monitoring. This is on the let me see, what page is that? Oh, it's on the second page of the outline. But what do we need to know about continuous monitoring in the hospital? How many leads do you use? Generally in the hospital it's 5. But like a Holter monitor is 5. Sometimes they will use 3 in the hospital. Most of the time that might be like your ER for like continuous monitoring. So if you are asked, a 5-lead EKG, like where do you see that the most?
Continuous.
Right, in the hospital telemetry or a Holter monitor. They used to only make 3 for a Holter monitor. But just know your difference there. You're going to use a 12-lead EKG for somebody who's going to be on a continuous. Too hard to keep them all on. 3, here we go. So if I say you need to do a 3-lead EKG, you know where they go, right? What are your 3? That's your limb lead over here. Right arm, left arm, and left leg. They're your 3-lead EKG. Do you see how this is giving you electrical activity between this one and this one, this one and this one, this one and this one, this one? I mean, so you'll be able to get a good picture of that electrical activity. So if you say 3-lead EKG, where are you putting them? Right arm, left arm, and left leg. Now, this is not on the arm, is it? It's on the torso. But if you're doing a 3 lead or a 5 lead, that person is probably ambulatory. They're walking around. They're moving their arms and legs. So you're going to put them more on the torso, especially if they're going to be walking around. Now, if you're doing a 12 lead and the person's laying down, they're still, you can put them on the wrists and the ankles, like where you see the EKG, the 12 lead. But for any kind of ambulatory or moving around telemetry, you're going to place these limb leads on the torso, right under that mid-clavicular line. Like, see it, that's why we talked about that, just under the left clavicle, mid-clavicular, that's where they're going. And this one's going here in the left lower torso. So you're basically putting it like in that mid-clavicular line, but all the way down. So like right like above the hip area, still in line with that upper torso. So for 3 lead placement, everybody understand where they go.
Yes.
5 lead placement. So here we go. Oh, we need 5 leads. Why? It gives us more information. What are we doing with that right? What did we say that right lower torso did? It's a ground, basically. Now, can y'all see a problem if you switched these? Say I put the right on the left, right, because they are designed to specifically pick up that part of the heart, that flow of electricity. That's why you have to be pretty conscious about where you're putting them and that you don't get them flipped. So for a 5 lead, here's where your 5 lead. What makes this different is that you're putting on the right because you got more going on here, so we need that. And then your V1, which is on the right of the sternum, right, at your 4th intercostal space. Right here. Everybody understand those? And they are color coded. They are, and they're universally color coded. So a good one to remember is clouds over grass and smoke over fire. That if you had to remember, where do these go? Like that's where they go, color coordinated. They should be labeled for you. And then your V1 is always, always going right here. So 4th intercostal space, just to the right of the sternum. So if you feel that person's sternum, that hard bone in the middle, and you go to their 4th intercostal space and you just slide over a tad, that's where you're putting your lead or your electrode with your lead wire. Everybody got that for a 5 lead EKG. So if you could tell me the difference in placement in a 3 lead and a 5 lead. So if you have a 3 lead, where are you putting your additional 2 leads?
Left lower torso and left.
Nope. If you have a 5 lead, I already have, say I have a 3 lead on and I want you to do a 5 lead. You got 2 extras, right? Where are they going? So if you already know where your 3 lead, you already know where your 3 lead is, right?
The right lower?
You're putting your right lower and your V1.
Yeah.
So a 3 lead is, you got your right arm, your left arm, and your left leg, right? I'm getting a 3 lead EKG. It's easy, said and done, blah. But then the doctor comes in and goes, I really wanted a 5 lead. So you go, okay, well, let me get 2 more electrodes and let me get these 2 lead wires. And where am I putting them? Right leg and V1. Because are they here? No. That's a 3 lead. So 3 lead, 5 lead. That makes sense?
Not really.
Why? Tell me why.
I don't know.
It's a lot of overload after your test and after all that, but we're getting to the whole like 12 lead, like your 12 lead. Like that's the big dog, right? That's what you're doing. If you go in to do a 12 lead EKG, that's where you have to do 12 of these or 25 of these when you go to do your clinicals. But by then you'll be ready to just slap these on. But again, if you go in there and the doctor says I only want a 3 lead, oh well, okay. Well, a 3 lead EKG means I need to put a lead wire and electrode to the right arm, and left leg. With a 5 lead, we're adding right leg and B1. If I want a 12 lead, if I want the picture of everything going on, then I'm adding all of these, B2, B3, B4, B5, B6. That is a 12 lead EKG.
So where it says RL and LL, that's not your legs.
It is,
I mean,
but they're here on your torso, just showing you that if you, like, you don't have to put them on the arms and legs. They can go on your upper chest and your lower torso. If you need to do a 12 lead, say the person's having a stress test, would you put those leads on their legs?
no.
Because they're walking on the treadmill. You're never going to get good movement. You're going to be so frustrated with that EKG because it's going to be all artifact and shaky, and you're not going to get a good picture, and the doctor's going to be pissed. So those are just showing you. I don't know if anybody here has ever had an EKG where they did put them up here and up here. Maybe you have on jeans or like leggings, or and you can't get your pants off or whatever. They as long as they are mid-clavicular, right under that clavicle bone, and on the lower torso, and as long as they're opposite of each other, that's the other key. They have to be. Do you think you could put the right leg way down here on the ankle and the left leg up there?
No.
They always have to be in sync. So if you have to, this person has a amputated arm and you have to use this upper torso for their right arm, do you think the left arm can go down here? No, it has to go opposite. So if all we're talking about is placement, 3 lead, 5 lead, 12 lead, this is the difference. That's all we're talking about. This is what we were talking about. You see this picture, the placement of limb leads? They can go here on the inside of the wrist, here on the top side of the ankle, right? If you needed to put them here, here, and here. This is probably the most common. But what if you have somebody come in and they have big old like surgery wound right here? You're not going to be able to use that. You could use the thigh as long as you use both. Does this make better sense?
Why you got 4 though?
Where? It's just showing you your limbs, the limb leads.
Oh, okay.
Yeah.
So what color, the LA, your left arm and V3 are both green?
That's black. Oh, you talking about RL, this one? Yeah.
Yes. I meant
Sometimes
RL.
yeah. And sometimes that's just going to happen. Nobody's ever going to, I don't know. I mean, I would know them just as a reference, but I mean, it's not like you are going to have to know these colors and be able to put an EKG on only by the colors. They're going to be labeled. But if you ever question yourself, oh, well, here's the thing. This green, it's going to be labeled, but you just know I always going to put the green one here. And that's how I remember it. Cloud over grass, smoke over fire. How, I don't, like, that's just, but, and honestly, like that, yeah, you're going to have 2 of the same colors. But what are we mostly worried about? These, because this is just our ground, right? So when do we only use that? In the 3 lead, we don't use that, right?
No.
We use the right, left, and left. In a 5 lead, we would use that. In a 12 lead, we would use that. Because you got to have ground somewhere. But we don't need a ground when you're doing a 3 lead because there's no electricity going that way. You're just doing you want to measure what's going through the heart. Does that make better sense? Like when you look at this 12 lead, these could be down below and those can be on the arms. You could put these right here on the bicep. You just need to make sure they're positioned equally and they're getting that picture, like they're opposite of each other so that they're sending their electrical charge through the heart, or they're measuring that charge between each other. Again, it's like when you take CPR and you put on those defibrillator pads. If you put them both on the same side and the charge doesn't go through the heart, too bad for the person. That charge has to be front to back, top to bottom. It has to go through the heart. And that's what, if you're measuring electrical activity, you want it to go. If your house gets hit by lightning, you know what happens. It gets hit and it travels, right? It's going to travel to the lowest part. I mean, that's what's happening with electricity. It's going to travel. And it usually travels from top to bottom or side to side. Does that make sense? Kind of. I think if you read the chapter and you do like and this gives you the colors, that white, green, black, red, brown, yellow, green, so greens repeated, blue, orange, and purple. You will always remember those because those are Clemson colors, and B5 and B6 are the top two, so you're always going to remember that that's orange and purple, right? So there. But would I be familiar with this? Yeah. But you'll know it the more you do. My brain hurts now. How about any questions? It's a lot. It's just to dump you in so that when you start to read chapter 5, I know a couple people have, that it's just making a little bit more sense. You're familiar with the terms. That's the main thing. Leads, electrodes, the different monitoring. What do I know? 12 lead has 10 electrodes and why that is. A 5 lead, do I know where they go? A 3 lead, do I know where they go? Do I know what my augmented leads are? Like those kind of things. That's all in the book. Just look at the main points. The outline comes straight from it. If you just remember one thing about each thing, like each topic, you'll be fine. The main thing with this is knowing the testing. Like if you need to do ambulatory monitoring, are you going to be putting on 12 lead EKG? No. No one's walking around with a 12 lead on. So read chapter 5. Well, I will send y'all all a piece of the, I'll email you the, like some graph paper and some different handouts. I did send some handouts. I think, everybody get the 2 handouts that had like the test on them?
Yes.
Mm-hmm.
Okay, those are good references. Those came from the big book. So those are good reference charts to go by. Just read it, like let your brain resolve, and everybody did fine on the test. Like everybody passed, so I mean that was good. But just don't stress out over it. But yeah, if you have any questions, let me know. Just do the review, and then when we look at it again on Tuesday, if you've read the chapter and done the review and you've kind of studied over the things and filled out, like go through, it'll all make more sense. This is just a lot, but it's easier when you start to figure out like what we're doing with this. Any questions? Everybody's
I think
tired.
I think it would be more better when we all have hands-on.
It is, and you're exactly right. And it is when you can feel it, when you can look at it, when you can say, oh, these are the leads, you're exactly right. Look up, like go to YouTube and look up, an EKG. Look up somebody doing an EKG. I'm sure there's videos out there that shows you how to do them. Like just look those up and be familiar like with that and looking at it that way.
Yeah.
Look at as many videos, and I'll see if I can find something too, and I'll send y'all the links. But that it'll get you familiar with, oh, this is what we're talking about. Because yeah, you're right. In class we have a machine, we're all putting our hands on it. We at this point we would all like put the electrodes on, stick them all over. So like it is hands on. But again, if you just know, okay, well let me just study this picture and like listen. But I would go to YouTube or go to any of those sites and watch videos on how to do an EKG. I'll look for some too and send them to you.
Okay.
Everybody good? Everybody's now ready to go and like have a drink. I know that was a lot of information. If y'all need anything, just holler, or if you have questions about the test or about this stuff on chapter 5, just let me know. I don't mind walking you through it or talking to you through it on the phone.
Okay.
All righty. Y'all
Alrighty.
y'all have a good weekend.
You too.
Too.
Have a great weekend.
Thanks.
Safe.
Bye.
Thanks.
Bye.
Oh yeah, it's Memorial Day. Bye.